When a severe burn happens, those first few minutes are an absolute race against the clock. And what first responders do in that critical window, well, it's not guesswork. It's a very precise, life-saving protocol. Today we're going to break down that exact plan step by critical step.
So picture it, you're in the middle of total chaos. Someone is severely burned. What's the first move? It's not just one thing, it's a super fast sequence of actions. Let's walk through the playbook that the professionals use to control the damage and, literally save a life.
So here's our game plan. First, we'll see how responders gather clues in all that chaos. Then, we're going to dive into how burns are actually classified. From there, we'll cover the immediate, critical actions right on the scene, the advanced medical response that follows, and finally, we'll really get into why this precise protocol is the key to survival.
First up, assessment. In an emergency, your first instinct is to just jump in and act. But for a first responder, the very first step is to see. They're trained to read the scene, to look for these critical clues that are going to guide every single decision that comes next.
It all starts with them playing detective, asking a ton of questions. Was this a fire, a chemical, an electrical shock? How long ago did it happen? Was there maybe a fall or a blast involved too? And maybe the most important question of all, did they breathe in the danger? The answer to each of these questions completely changes the next move.
Now here's something you might not expect. The most immediate danger often isn't the burn you can actually see. Responders are listening really closely for hoarseness or wheezing. Why? Because those sounds can mean the airway is swelling shut, and that is a life-threatening emergency that takes priority over everything else.
Okay, so once they've got a handle on the situation, the very next step is to classify the burn itself. The entire treatment plan, everything that happens from this point on, really hinges on this assessment.
We all know this one. It's your classic sunburn. It's red, it's painful, because it only affects the very top layer of skin. But here's the key thing to know. While it definitely hurts, it's not included when they calculate something called total burn surface area. That metric is what tells responders if the body is in serious danger of losing too much fluid, which is when the big interventions, like IV fluids, are needed.
Now we get into the more severe burns. Over on the left, you've got a second-degree burn with its classic blistering and swelling, and it is incredibly painful. But then look at the third-degree burn on the right. The skin is charred, and here's the really scary, counterintuitive part. It's often painless, and that is not a good thing. It actually means the burn is so deep that it's destroyed the nerves themselves.
The how is just as important as the how bad. A flame burn is treated way differently than a chemical burn, which needs immediate decontamination. And an electrical burn? That's even trickier. It can cause massive internal damage that you can't even see on the skin. So the cause completely dictates the care.
Okay, assessment is done. Now it's go time. These are the immediate, hands-on steps that happen right there on the scene, in the moment.
This right here is the core of on-scene care. 1. Get any clothing off that isn't stuck to the skin to stop the burning process. 2. Get all jewelry off. This is absolutely critical, because swelling happens fast and can turn a ring into a tourniquet. 3. Leave any blisters alone. They're actually a natural barrier against infection. And 4. Cover the burns and keep the patient warm. A burn victim's skin can't regulate body temperature anymore, which makes hypothermia a really serious threat.
This number right here, it's a critical trigger. If more than 10% of the body has a serious burn, responders immediately start what's called fluid resuscitation, basically pumping fluids directly into the body. Why? Because severely burned skin can't hold fluid in, and the body can go into a life-threatening state of dehydration called burn shock.
All right, so now we're moving into the next level of care. This is the advanced stuff, the procedures that paramedics and other highly trained responders can perform.
So this is where advanced life support really kicks in. To get those critical fluids in, they'll start an IV line into a vein. Or if they have to, they'll use what's called IO access, which goes directly into the bone. For major burns, they'll often start 2 separate lines. And at the same time, they're hooking the patient up to a heart monitor and constantly rechecking that airway for any signs of swelling. Airway management. That basically means intubation, placing a breathing tube. It is a high-risk, aggressive procedure, and the protocol is crystal clear. You only do it as an absolute last resort, when the patient literally cannot get oxygen any other way. It's a perfect example of the disciplined, high-stake judgment required in these moments.
So once the patient is as stable as they can be on scene, the final step is transport, and the destination is key. It's often not the closest hospital, but a specialized burn center. The goal is simple: get them to the experts and get them there fast.
So, we've walked through all the steps, but let's just zoom out for a second. Why is having a standardized protocol like this so absolutely vital?
Because in a moment of pure, unadulterated chaos, a protocol provides clarity. It gets rid of hesitation and doubt. It makes sure every single patient gets a high standard of care that's based on proven best practices. It turns a terrifying event into a checklist of life-saving actions, which directly leads to better outcomes and, ultimately, saves lives.
You know, this protocol is just such a powerful reminder that a clear plan can bring control to chaos. It saves lives in an emergency for sure, but the principle applies everywhere. It really makes you wonder what other chaotic parts of our work, or even our lives, could be made better with a clear standard plan.